Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. Last time we were together, we talked about neck pain. We talked about how painful it can be and how chiropractic can help patients who have neck pain. Today, we'd like to talk about another area of the back that bothers so many of our patients and the population in general. Of course, I'm talking about low back pain. Just a few quick pieces of trivia concerning low back pain. 1. Low back pain is the single leading cause of disability worldwide, according to the Global Burden of Disease 2010. 2. Back pain is the most common reason for missed work. In fact, back pain is the second most common reason for visits to the doctor's office, outnumbered only by upper respiratory infections. That's an interesting one. Didn't know that, did you? 3. Americans spend at least $50 billion a year on back pain. That's billion with a B. And that's just for the more easily identified costs. Experts estimate that as many as 80% of the population will experience a back problem at some time in their lives. Since low back pain is so pervasive in our world, it seems to me that we should know a little bit about it and what can be done to help those who suffer from it. Let's get started with the basics. Doc, what can you tell us about the low back?
The low back is actually made up of 3 different areas of the back. There's the lumbar spine, the sacrum, and the pelvis. The anatomical relationship between these things is what gives us the miraculous ability to function as we do. To bend over, twist side to side, to pick up that putt that we dropped in the cup. It also allows us to pick up heavier things like a couch. Just think about it. If it wasn't for the ability of the spine to be so flexible, we wouldn't even be able to sit in a chair. It's amazing when you think about it how the low back allows us to do so many things. Anyway, the lumbar spine portion of the low back is made up of 5 vertebrae. As with the neck that we talked about last week, these vertebrae also have those discs between them. We called them intervertebral discs, if you remember.
Yeah.
And these vertebrae are connected to each other by ligaments and muscles and have joints between them. These are important structures to know about, and they are a great source of low back pain.
Doc, last week we talked about the spine of the neck being a conduit for the spinal cord that comes off the brain. Does the lumbar spine house part of that spinal cord as well? How far down does it go?
Well, things are a little bit different in the lumbar spine. The lumbar spine houses what we call the cauda equina.
Okay, there's another big doctor word. My Latin's kicking in, something about a horse.
Very good, Laura. You're close. The spinal cord itself ends in the spine at a level even with approximately the bottom of the rib cage, maybe a little lower. And at the end of this spinal cord, nerve roots are given off that extend down the rest of the lumbar spine and into the sacrum. These nerve roots are collectively called the cauda equina because if you could see it, it would look like a horse's tail. Just like the neck, though, these roots then exit the spine in openings between the vertebrae and go out to the body. These openings in the lumbar region are called intervertebral foramen.
See, I told you, something about a horse tail.
You are so smart, Laura, so smart. Another section of the low back is the bone called the sacrum. However, it's difficult to talk about the sacrum without talking about the bones called the pelvis at the same time, so we'll discuss these structures together. The sacrum is a triangular bone that the lumbar spine sits on. The very end of the sacrum is also called the coccyx and is also known as the tailbone. And if you've ever fallen on your tailbone, you are very well acquainted with this structure as that type of fall can be oh so painful.
Oh, yeah. You don't forget that anytime too soon. That one stays with you.
Absolutely, Laura. Absolutely. The sacrum has openings as well, though. These openings are called sacral foramina, and it's through these openings that the nerves pass out and go to the lower part of your body. The pelvis is made up of two bones called the ilia. There's a right and left ilia, and together these two bones make up the pelvis. So let's do an experiment, Laura.
Okay.
If you're able to, folks, stand up, put your hands on your hips. You feel those two bones? Those bones are the upper outer edges of the ilia.
Oh.
The sacrum and the pelvis then work together as a unit to provide support for the upper part of your body and to aid in locomotion.
Now, is that the bone that you feel right after the fleshy part of your waist, like directly on the side of your...
That's correct.
Both sides of your body?
That's correct. And folks, once you felt it, you can all sit down. The lumbar spine then sits on the sacrum, and the sacrum is attached to the pelvis on both sides in what are called sacroiliac joints.
Sounds like we're about to sing the bone song. You know, the foot bone's connected to the ankle bone's connected to the leg bone. Hit it, Doc.
The leg bone's connected to the hip bone.
I think we'll spare our listeners from any more of that. Sorry, guys, that was a little sidebar. Let's just let you keep that in your childhood memory. So back to the program. Doc.
Good idea. Good idea. Now, it's through these sacroiliac joints that the weight of your upper body is transmitted to the legs and feet. When you sit down, you can somewhat eliminate this weight, and you can tell because your legs and feet will feel the relief of not carrying that upper body weight.
And the older you are, the more you can feel it.
Absolutely. Another important function of the sacroiliac joint is to assist your body in walking or locomotion. Every time you take a step, your sacroiliac joints move.
Or should move. How many times have you called me back after I've walked away from you to tell me your right SI is locked up? How can you tell? And anyway, why were you watching me walk away?
A two-part question. One, how can I tell? Your hip sway is not the same side to side. You have a little bit of a hitch in your walk. And two, I was watching you walk away because I'm your hubby, and it's part of my job, and a part I take very seriously.
Now, sir, this is a G-rated program. You're giving me the vapors. Now back to the back of everybody else. Onward.
Okay, let's get started again. Why is all this low back anatomy so important to know? We've taken a lot of time to explain the anatomy, and it is important to know. So why is that? It's because the anatomy I just discussed is a significant source of low back pain. The susceptibility of the lumbar spine, that is the sacrum-pelvis mechanism, to injury is due in part to biomechanics, that is, the way they work. Activities and events that affect low back biomechanics include extended sitting, repetitive movements, accidents, falls and blows to the body, normal aging, and then just the everyday wear and tear.
Okay, so what are some of the more common causes of low back pain? What do you see the most?
Well, just like with the neck we discussed last week, injuries and accidents are probably the most common. You know, that sudden and forceful movement of the body in any direction very commonly causes low back pain. And then you have just the generalized growing older. Degenerative disorders such as osteoarthritis, spinal stenosis, and degenerative disc disease directly affect the spine of the low back.
All right, there's that word stenosis again. Will you remind us of what that means?
Very simply put, stenosis means narrowing. So just like the neck, there can be a narrowing of the spinal canal in the lumbar spine. Another cause of low back pain is just our daily life. You know, the poor posture, sitting at the desk all the time, being a bit overweight. I know a little bit about that. Weak abdominal muscles. These things often disrupt spinal balance, causing the low back to compensate. Stress and emotional tension can cause muscles to tighten and contract, resulting in pain and stiffness. Postural stress can contribute to chronic low back pain, with symptoms extending into the buttocks, legs, and feet.
A couple of words caught my attention there. Stress and emotional tension. Can that really cause you to have a pain in the back? Is that why people wake up and say, I have no idea why my back's hurting. I have no idea what I did to make this happen. I was just living life.
Certainly it can be a cause, and you're right. Stress and emotional tensions are powerful forces that affect our bodies in many ways. So very commonly, patients can wake up and say things like, my lower back's hurting and I don't know why. Certainly can be caused by emotional stress and tension.
Why? Because they just tighten up if they're in an emotional spot, and they just...
That's right. Emotion certainly can tighten up muscles, causing spasms, and over time that can result in lower back pain.
Fascinating. Let's look at some additional conditions that can result from low back pain and injury. Doc, tell our listeners about some of the more common conditions that we see that people might experience that they may or may not know come from the low back.
Well, before I do that, let me first off say there are many serious injuries that can occur in the low back that can be almost life-threatening. Things like fractures, spinal cord injuries, compression injuries. All of these can cause some type of paralysis or other functional deficits. These injuries are medical emergencies and require emergency medical treatment. What I'm going to talk about are the non-emergency conditions that we all experience from time to time. A good example of that is the piriformis syndrome, which is a muscle trigger point condition.
We see the piriformis syndrome a lot in our office. Doc, can you briefly explain what that is?
Well, you ready for another anatomy lesson?
Yeah, we need one of those, like the what and where.
Okay. The piriformis muscle is a small muscle, and it's located in the buttock region of our bodies. This muscle is an external rotator of the hip. In other words, it turns your foot outward.
Oh.
This muscle also has a very unique relationship to the sciatic nerve. The sciatic nerve is a confluence of nerves that comes from your lumbar spine and goes down to your leg, and interestingly enough, passes directly underneath the piriformis muscle. And what can happen is if this muscle goes into spasm, it can literally pinch that sciatic nerve, and it can cause sciatic pain, which is pain running down the leg. And it can also cause pain in the buttock, especially when you push on it. Very, very tender. So that's the piriformis syndrome.
Yeah, that's a really painful one we see in our office.
It's very, very common. I don't think people realize how common that one is. Another condition that we'll see that comes from your lower back is, in fact, that sciatic neuralgia neuritis. That's numbness and tingling, weakness, pain, things along that line. And it can be caused, yes, by the piriformis syndrome, but it also can be caused by disc injury in the lower back. It can be caused by joint irritation, causing the nerves to become irritated, resulting in that numbness and tingling and pain that patients can experience going down the buttock, legs, and even to the foot and toes. Another example of an injury in the lower back is the herniated disc.
Ooh, big ouch. Again, how can you tell a disc injury from other types of low back injuries? Can you expound on that a little bit?
Sure. The most common and definitive way to delineate a herniated disc injury is an MRI. But outside of that, there are some signs and symptoms that the patient who has a herniated disc will exhibit. One of the more common ones is they'll end up leaning off to the side. I know you've seen this, Laurie. In our office, we'll have patients coming in that are in severe pain, and they're crooked. They're leaning off to the side. That's a pretty clear indication that that patient has some type of disc injury which causes them to be in severe pain. Another example of a lower back problem is that degenerative process we call osteoarthritis. It's a common joint disorder, and it's caused by the progressive deterioration of the cartilage of the joint. The body can react to this by forming bone spurs, and those bone spurs can affect joint motion. This would also include a degenerative disc disease. We see that very commonly. It's very evident on an X-ray when the disc space is very narrow.
Oh, is there anything you can do about that?
No, not really. But what we can do is help people maintain function.
Is there anything you can do to prevent it?
Well, again, we can help patients maintain a more normal functionality of their spine, which can reduce the risk of a degenerative process from either starting or slow the process or maybe even stop it from getting any worse. But you can't undo the damage once it's already occurred. And then we have spinal stenosis, something we talked about a little bit earlier.
Yep.
In other words, the stenosis then causes the passageways that the nerves pass through to narrow, can cause compression and trapping of the nerves, and can be very painful, can result in that sciatic pain that we talked about earlier, pain in the buttock, pain in the leg, pain in the foot or toes, can also result in numbness. What happens is these nerves are not functioning normally because they are being compressed.
Also, maybe a little tingling. Is that also a normal?
A little bit of tingling is not uncommon as well.
Okay, Doc, let's talk about injury from cars and other types of accidents. It's not necessarily cars. It's, bicycles, motorbikes, and, other kinds of vehicles where the locomotion's involved. What happens to a person's low back when they're involved? And let's just use the car accident as an example. It's the most common one.
I think it's a good one to use because most people are aware of car accidents. They kind of know what happens to the body when you get rear-ended or if you end up rear-ending somebody else. Again, just like the neck, you've got the mechanism of being forcefully pushed downward, in other words, compressed, and then the hyperextension, hyperflexion injury can occur.
Downward first?
Downward first. And it's that compressive force that they think results in the disc being damaged. I think research has panned this out pretty effectively, that the compressive force within that first tenth of a second of the auto accident is what can damage the spinal disc. I
don't think people think of it that way. You think of that forward and back motion. I know I never did. I never thought about, the compression the force pulling you straight down first, then forward and back. That's a good point, and it did take some research to figure that one out. But yes, the compressive force is the first thing that happens according to the research. Now, the lower back is a little bit different than the neck in that most people are strapped into their car via the seat belt. So that does help stabilize the lumbar spine a little bit better than obviously the neck would be. However, you still have the compressive force from the accident that can result in injury to the spine. You also can have this sudden whipping motion in the lower back, although it would be somewhat restrained by the seat belt, but that can also occur in the low back to result in what I like to call low back whiplash. You're going to explain that, right? Yep, just like in the neck, the muscles and ligaments in the lower back will respond the same way by tightening and contracting, creating muscle spasm and fatigue. And very commonly, that results in pain. This injury can also be associated with injury to the intervertebral joints. Those are the joints that are between the vertebrae. Ligaments and muscles and nerve roots can also be injured, just like in the neck. Car accidents are one of the most common causes of low back whiplash, and research has clearly demonstrated that the speed of the accident isn't always the most important factor in determining the severity of injury. Yeah, I think we talked about accident speed last week as it concerns the neck. Even that couple of mile-per-hour tap on your bumper could be enough to cause injury. Like, for example, 2 cars backing out of spots at the shopping center at the same time tap bumpers. Even that could be enough. And remember, you might not feel the stiffness or pain for a few days or even a few weeks after the accident, correct? That's true. I think you said that last week. Yep, it's that delayed reaction that people ignore. They just think it'll go away. It didn't come on right away, so it'll go away. Yeah. So it's very important that you see someone after an accident, even if you don't think you're hurt. It could save you a lifetime of pain and suffering. My sister's a great example of that. She had an accident 25 years ago that she thought she was okay and didn't have it checked out. And today she still suffers from chronic upper back and neck pain as a result of that accident. So now that we've laid out some of the more common causes of lower back pain, Doc, how do chiropractic physicians diagnose the different causes of lower back pain? In much the same way that we evaluate patients for neck pain, we'll evaluate the patient in their lower back condition. We'll ask questions like, when did the pain start? What have you been doing for your pain? Does this pain radiate or travel to other parts of the body? Does anything you do make the pain worse?
or does it reduce the pain? Then we would do a physical and neurological exam. In your physical exam, we'll observe your posture. We'll test your range of motion and see what movements cause pain. We will palpate or feel your spine and the sacroiliac joints, noting the curvature and alignment. We'll also feel the muscles for spasms. We'll also check out the buttock area because that's where the piriformis muscle is, and that is not an uncommon area for patients to have pain. During the neurological exam, we'll test your reflexes. We'll test muscles to make sure they're strong. We'll also look for other neurological changes. We'd also do an orthopedic evaluation, which would include specific tests of function to determine what structures that we talked about earlier are involved and how much they are involved.
Oh, sounds like a lot.
It's a relatively extensive examination, and I think we chiropractic physicians pride ourselves on the fact that we do a complete exam. In some instances, then, we might also order additional tests, an X-ray, which might help to demonstrate a degenerative process, or a fracture, or bone spurs, or an arthritic condition. We might order a CAT scan or a magnetic resonance imaging test, also known as an MRI, to demonstrate disc injuries, herniations, and bulges, etc. And if we suspect that the nerve has been damaged, we may order a special test called an electromyography or an EMG to measure the function of that nerve.
So that's why in that first visit it takes a little more time
That's
for
right.
you to do that examination. That's going to be probably their longest visit ever.
Absolutely. They're going to think, am I ever going to get out of here? But yes, it's all important information that we need to make the clearest and most definitive diagnosis so that we can treat you appropriately.
Okay.
And speaking of that, remember, chiropractors are conservative care doctors. Our scope of practice does not include the use of drugs or surgery. If we diagnose a condition that we think may need drugs or surgery, we will refer you to the appropriate medical physician or specialist. We also may want to co-treat you with that medical specialist. So we would ask your permission to talk with that medical specialist so that we can ensure that your chiropractic care and medical care are properly coordinated.
What treatments are commonly used for patients that have lower back pain? What do you do about it?
In the same way that we treat the neck, we would treat the lower back. Spinal manipulation is the core treatment that a chiropractic physician uses in his office.
Better explain that one again, Doc. Manipulation. It sounds like sometimes that's not a good thing.
Manipulation is us using our hands or other tools to actively move the joints of your spine to restore a more normal functionality of that specific segment of your spine in its relationship to the guy above or below.
That's where the thumper might come in again. Not
Sometimes,
just with
that's
your
right.
hands. You use, there are a couple of pieces of equipment that you
That's
use to
right.
do.
The activator, we like to call the thumper. Some patients don't care for the hands-on manipulation, so they would much prefer the activator, and we certainly would use that to accommodate them. We would also utilize physical therapy modalities, things such as electrical muscle stimulation, ice and heat, mechanical traction, which would include spinal decompression, and that's very common in the low back. When you have a disc herniation in the lower back, one of the best modalities that we have found for treating those disc herniations non-surgically is spinal decompression. Another therapy we might use is cold laser. Cold laser therapy is the utilization of light in the specific frequency of wavelength to stimulate the healing process in the body.
A lot of people look at me when I say, "Oh, we're going to shoot you with the gun, use the cold laser," and they're hesitant. I'm like, "All right, here's what it is," and I put it on their arm or something, and I ask them what it feels like, and they just look at me because they know they need to say something. I said, "It feels like a bunch of nothing, doesn't it?" Because you don't feel it.
Yet there's nothing to feel. It's just
Right.
light. But that light is in a specific range of frequency, and that's what's important to stimulate the cells of your body to begin the process of healing.
And explain what that EMS thing is again.
EMS, electrical muscle stimulation, it's the utilization of electrical current and its properties to stimulate healing in the human body.
That's that hands-off massage everybody loves so much at our office.
It is very, very relaxing. Another therapy we might use is ultrasound, the utilization of sound waves to help break up muscle spasm, to induce heat in a muscle, as well as reduce pain. We also would use back braces and lumbar supports.
Doc, we're asked from time to time about braces, those back braces, neck braces. Those questions, do I need a brace? And how long should I wear a brace? Can I wear it all the time? Can I wear it to bed? What do they do?
Braces are an interesting topic, and I have a very strong opinion about braces. And I realize that not everyone would necessarily agree with me. I am not a huge fan of braces because I think patients can become dependent upon them. Very commonly, you'll see a person walking through the grocery store that'll have a neck brace on. And I do understand that it does provide support, and on a short-term basis, it certainly can be an effective tool. But for a long-term recovery, I am not a fan of the brace because I think it does create a dependence by the patient on that brace, so that they can never get rid of it, and it will actually slow the healing process in the area concerned.
Interesting.
Another thing we might do for a patient is provide them nutritional supplementations for things like inflammation. There are some great natural anti-inflammatories out there that would be useful for patients who don't want to take prescription medications. Once you're feeling better, then we would add in some rehabilitative exercises and some stretching, instructing the patient on how to do specific exercises to enhance the healing process of the lumbar spine. So there are some ideas about some of the things we might do to help the patient in recovering from low back injury.
Okay, I think that's it for us this week, Doc. We're running out of time.
And now for the tip of the week. Ladies, those high-heeled shoes you wear may look nice, but they wreak havoc on your low back. You might want to limit the time you wear those heels to just a couple of hours, and only on that special night out. Be careful of the shoes you wear so as to maintain good posture and a healthy back.
And ladies, if you want to find some cute and fashionable shoes that also provide an incredible amount of comfort and support, call our office or stop by. I'll be glad to show you some of that footwear, not only for the women, but also for the men. We're located at 275 Tony Penna Drive, Suite 12. And our phone number again is 746-4242.
Before you sign off, Laura, I'd like to invite our listeners to Google Volstead Chiropractic and visit our website.
Join us next weekend for another edition of the Chiropractic Corner right here on the Jupe, WJUP 103.9 FM, Saturday and Sunday right after the 10:30 news. Until then, be well, live well.